But you can't reach young adults the same way you reach adults,
Right.
because the very
Right.
thing in young adults is if-then consequences. Young adults in general who don't experience any kind of disability have trouble determining, if I have that problem, I shouldn't hit that kid. If-then consequences. Right. But then with a psychiatric disability, it becomes that much more enhanced, that level of not being able to discern, should I do that, should I not hit that kid? And they can't see further along. Right. So thinking about that, so they really have to be specific. And peer mentoring has been really a critical piece in that. Can you talk about your peer mentoring experience?
Well, peer mentoring was good for me. It validated my recovery, and it helped me learn about the system as a whole, a lot of aspects about the system that I didn't know about before. And it was just a growing process. It wasn't even really like a job for me. It was a mutual gain for me. And I think one of the important things about peer mentoring is that there's such a line. It's like 18 and below and 18 up, and that can go on forever. But around those ages, and it's flexible. It's like 16 to 25, and more flexible to people slightly older than that. To kind of let them know, because we value that at that point in time, it's a very social point in people's times, somewhat more so than later teenage years, developing more mature systems of self, still within a really social environment. So kind of instead of just having people around that age with people of much older ages and being like the one or two young people in the program, really putting them together, validating that's a social time. And I think mentoring brings that out to places where I worked with a lot of people who were in programs where they were that only young kid, and then they got to get a connection to the peer community in general. I got a connection with them. They helped learn the services. So it's just kind of a validation of what people at that age would go through if they didn't have a diagnosis, and not necessarily pushing them away from that.
Right.
Yeah.
So it's really helping them make connections, because a lot of people move forward with looking at a role model. You have to have someone that you connect with, is someone that you admire, to know it's possible. Roger Bannister was one of the people who broke the first 4-minute mile, and after he did, many people did, but they had to know it was possible. So that's why the peer mentoring is so effective, because people can see, wow, this person is that much further along in their recovery, and success leaves clues. How do we do this? You know.
And at that time, Kim, there were 5 demonstration projects across the country looking at transition age youth, federal grants that people had gotten, and one in Maine and one in Utah. And we were looking at those grants, and I researched them and said, a couple of them had this title, Statewide Young Adult Coordinator, and I said, we need one of those in Massachusetts. And so wrote up the job description, Empower and the Transformation Center and CQI said okay, the department said okay, we got some money. And we put together this position, and then we put together a statewide young adult group. You know, and you have to understand, when you're doing this, everybody's saying, oh, it'll never work, we can't provide transportation, they're not going to be able to get there, how are you going to get the food, where are they going to meet? We went through all of that, and we got it going. We had our first statewide young adult coordinator. Matt joined the first group, and after
Jessel was awesome. He was the original coordinator.
Jessel Paul Smith
he really pulled it all together.
He was the first, and then he moved on, and we presented down in Washington to the GAO when we did a report. And then Matt came in, and we have, I think, just done some incredible work this past year, starting with the cans. And with Matt has a different approach to it. Using a lot of filming and all of that. You can tell folks about that.
Jessel was originally starting that idea. We were, a lot of what we do is a lot of different organizations will show us what they're doing for their outreach and their programs and get our advice. And originally SAMHSA was doing that in relation to some PSAs they put out, and that gave us the idea to do our own. Jessel was kind of trying to organize it for a while, and he was having me and a gentleman, Luke, who lived in Western Mass, do it, but I live in Quincy, Luke lives in Western Mass, so it never really worked out. And but eventually that started to come together. That was really pushed by Jessel. And it just kind of grew. When I came into the position, we started doing more things. We probably have 3 videos on YouTube now. We have a website. We got a grant from SAMHSA to make a feature-length documentary. We're still working on that. So it's a lot of to-the-public stuff, but a lot of the content works with providers and legislators at the State House as well. And we're collecting a lot of data, and hopefully we're finding people to give them to, and different things like that. A lot of the stuff around the cuts and things like that. We're getting to get real organized around. So
You've been terrific.
Yeah,
You know,
yeah.
around the mental health cuts, the young adults, Matt has organized them, and they're presenting to the commissioner what they feel are their ideas for transition age youth services and what they need, and that they need to be included. And you did some terrific work with one of our assessment tools called the CANS. It's going to be used across the board. And the young adults went over the CANS document and said, this does not really reflect what transition age youth are experiencing as they go through this age bracket. So they've changed it. The person who wrote the CANS has redone it in relationship to us, and that's all a tremendous amount of input that young
and
adults
other groups
have.
they met with.
Right.
Yeah, it's just great.
And you've mentioned 2 websites that you have. You're on YouTube.
Yep.
Could you want to mention the site you're on at YouTube?
It's www.youtube.com/voiceofsyac.com, which is all one word, which is Voice of SYAC. So that's our YouTube page. And then the Transformation Center, they have a section called Communities, and we're the youth section. It's tons of pages, and any youth along the state who want to put input on that page for other youth who come across it, it's always welcome. We have some artwork, we have people's testimonies, experiences, opinions, links to pages we like, all sorts of different stuff like that. And we actually have this on the page too. A lot of the projects we're working on, we have listed that people could get involved in, as well as done projects and how people could take a look at them.